The bony pelvis around childbirth is important to understand. Not understand it intellectually, although that helps. But if you never, ever, ever look or Google the bony structure, you can still feel and learn how to work with your bony structure in birth and to how to prepare it when you're pregnant. The pelvis is where your baby has to move down through and out. The bones of the pelvis are surrounded by the soft tissue of the pelvis. There are 4 bones of the pelvis. Most of us aren't even really aware of that. And if we're aware of it, we don't really know where they are anyway. And we do need to understand that to some degree. Some of us have a very long tailbone or coccyx. Some women have broken their tailbone in birth and it's sore. Others have a tiny little nib and we never pay any attention to our tailbone. Most of us know that triangular bone in the back. It's attached to the bottom of our spine. It's called the sacrum. And at the bottom of the sacrum is our tailbone or coccyx. In the top of our sacrum, there are 2 bumps. And those bumps are part of our left and our right hip bone. And our hip bone is very complex in the sense that it's all over the place. You can feel those bumps on top of the sacrum. You can feel the hip blades. The bones you're sitting on now are part of those hip blades. And they wrap around the front to become your pubic bone. Pubic bone isn't one piece. There's a cartilage separating the left and the right side of our hip blades. So we have a lot of hip blade, and we have a sacrum, and we have a tailbone. So that makes 4 bones, left, right, sacrum, tailbone. And the question is, do they move? And the other question is, where's the cervix? Well, the cervix is part of the soft tissue, and it is the top of our vagina. Most of us don't ever feel in there. Some of us know we have a cervix. It's a little short thing, about 1 inch long, and it's got a really, really tight hole in it. We can't get our finger in. And then there's all this tissue on the top of our vagina. On this side is our vagina, and on the other side is our intestines, our bladder, and further up our kidneys and all our other organs. So the top of our vagina separates our torso and the organs in our torso from our vagina. If you look at a cross-section of a pregnant woman, you see a big baby, you see sort of a cross-section of the bones, and then you see this tiny little tube, and that's representing our vagina, our birth canal. But that's not a reality. But we're not talking about the soft tissue right now. We're talking about the bony pelvis. The bones move in certain ways and not in other ways. So for example, when you're sitting there and you're thinking about your sacrum and you're thinking about your tailbone and you're thinking about the bones you're sitting on, tuck your tail toward your rectum. You can do that. That is moving the sacrum like that. Now untuck it. And when you untuck it, you sort of arch your back. You are articulating the sacrum and it can move. That's one bone that you can move. You do it with your mind and you do it without tension in your soft tissue. We'll give you a hint of your soft tissue right now. Don't let yourself tuck your tail. Just be still and try to tuck your tail with that stillness. You can't do it. Try to push your tail back. You can't do it. All you've done is to say to the soft tissue in that area, don't move. It's no different than your head. So I want you to relax down there now. Now tuck your tail. Now untuck your tail. Now we'll go back to the head. Don't let your head move. Doesn't move. Doesn't move. I can push quite hard. It does not move because I've told my connective tissue, don't move. If I soften the connective tissue, then I can easily move my head. That's the power of the soft tissue, but we're talking about the bony structure. But we have to couple it to the soft tissue to some degree, and we have to couple it both to what we can do with ourselves, with our partner, and with our breathing. So we now know that you can tuck your tail and untuck your tail, and that moves your sacrum. What about the big hip bones? Well, that's a skill that Dad's developed called the hip lift, where if you lie down on your side and you press on your hip blade and you lift up on the bone you sit on, you can have sideways motion. And if you tighten up inside, you can stop that motion. So you can do that by hand. You can also, when you stand up and somebody is facing you sitting and they wrap their arms around you and hold onto your sit bone and you go into a squat, they can move the sit bones sideways. and creates space. When you are in a symmetrical position, like being on your knees, your hip blades are fixed. But if you go on one knee and put the other foot up, so your knee is bent like that, that makes your hips less symmetrical, and it is harder for you to put tension into that. If you are in a semi-recumbent position, being upright and sitting on your sacrum, you are fixing your sacrum on the ground, but your baby needs to move your sacrum back and out in order to come down to the birth canal, turn the corner, and come under your pubic bone to open up your vaginal opening. We had to figure all of this out, not in our head, but in our body, and use it. So what we found is that there's an inlet to the pelvis that's just above the pubic bone. We cannot feel all the way back to our sacrum. That's how front to back the inlet is, and sideways from hip blade to hip blade. But where exactly is the top of our vagina? If you feel where your legs come into your hip blade, that is where the top of your vagina is located. And if you draw a line to the middle of your sacrum and into the middle of your pubic bone, that is where the top of your vagina is. But if you feel the top of your pubic bone, you cannot reach all the way back to that mid part of your sacrum, nor side to side on your hip bones. So we can't feel that. We can feel the mid-pelvis, but we have to put our fingers up into our vagina and feel for the edges, the sides, the inside of the pelvic girdle. But we can find the outlet, and that's mapping your pelvis. You are sitting on your outlet of your bony pelvis. Those two bones that you're sitting on are the side-to-side dimension of the map. What your pubic arch is shaped like is the front of the map, and the distance between your pubic arch and your tailbone is the front to back dimension. You can map that. There are 4 shapes that women have. They can be pretty equal front to back and side to side. What kind of space is it they need? About that much space, side to side, and about that much space front to back. And about 50% of the women's population has that. That's the common shape of the outlet of the pelvis. Some women are wider side to side and shorter front to back. Some are longer front to back and narrower side to side. And very few are short front to back and narrow side to side. So babies have to navigate our bony pelvis space. But if we know what it is, then we can help our baby navigate it from the inside. Sometimes it's through positions that I'll talk about in another video. Sometimes it has to do with the tension inside that I'll talk about in another video. The bony structure overview is that you need to know that there are 4 bones. The sacrum is the most mobile, and the hip blades can move side to side. And when you're standing, you can move the sit bones side to side as well. And when you get into a position, if you get into a position that is asymmetrical, it is harder for you to store tension in the soft tissue inside your bony pelvis. BirthingBetter families realized that it was really important to prepare our bony pelvis around 24 weeks of pregnancy. When I gave birth in 1970, the Lamaze classes were taught quite late in pregnancy, and we understood from our own personal experiences, from about 36 weeks onward to the birth, our mind is really focused on other things rather than learning skills and preparing our body. 24 weeks, we're more than halfway through the pregnancy. We know it. We can feel our baby. Our uterus is up at our belly button, and we have a very clear mind. Now, there's an interesting thing about preparing our body. We don't have to do these skills every day. If it's easy for us to feel the hip lift and to feel the change, if we create tension in our soft tissue, we don't have to do it again and again and again and again because we've already embodied it. And one of the great things about BirthingBetter skills is that they are embodied skills. We understand them because that's what our body does. And when do we use the body skills in birth? if we don't feel the labor contractions are progressing. And I talk about that in another video, because the progression of labor was very important. Long labors are non-progressing labors. Yes, they can be due to the position of the baby, but more likely they are due to the inside of our body and how this big object with a head the size of a grapefruit is trying to navigate through it. So start at around 24 weeks and go through the skills first on your partner and then have them do it on you, because when they feel it in their own body, they're more effective birth coaches to help you as well.